In this morning's Health Watch, two big developments in the use of AI in medicine. A new study from the journal Radiology found that AI can spot patterns in mammograms that may help identify women at higher risk of developing breast cancer. We like the sound of that. The FDA also cleared the first AI tool that can detect certain forms of heart disease from a routine ECG. I was thinking not EKG, ECG. That technology was developed by Dr. Pierre Elias. He's a cardiologist and medical director of AI at New-York-Presbyterian and Columbia. We're happy to say he's here in the studio with us because some of the breakthroughs, some of the things you're working on are so exciting to me. It was interesting to hear that you started your career as a software engineer and then you switched to cardiology. I think that combination is very interesting. You did that why? Because you saw that you could really make a difference based on that background compared to being a cardiologist?
Yeah, I think pretty early on I realized my North Star was we deserve better technology in healthcare, both as patients and as providers. And the question became, how are you going to build it? You know, one of the amazing things about medicine is we have incredible technologies, but we also have some really cruddy technologies. And when you're talking about doing something great for patients, you really want to say, how do we take the best of what's out there and bring it to clinical medicine?
And what have you discovered when it comes to heart disease and technology? Because there's so many tests for so many different kinds of things, but not in the heart field. Yeah,
around 7 years ago, I sat down with this fundamental problem, which is we don't have a screening test for the most common cause of death in the world, cardiovascular disease. We have mammograms, we have colonoscopies, we have pap smears, we have no equivalent for most forms of cardiac disease. And the reason for that's relatively straightforward. The way that we diagnose most forms of cardiac disease is either too invasive or too expensive to do at a population level. So we wait until patients develop symptoms, and then they're in a later stage of their disease. And what we know is when we diagnose people at later stages of the disease, they're more likely to have bad outcomes.
And so what you have found is that the AI is better at detecting potential heart disease than real doctors by a not insignificant factor. I think it was like by 74% for AI and like 68% for human doctors.
That's right. So what we saw was, you know, from medical school onwards, I've been taught that, you know, this cheap test, the electrocardiogram, which we do hundreds of millions of times per year, we can't use that to detect things like heart failure or valve disease or pulmonary hypertension. You know, I've read 10,000 EKGs as a cardiologist and I still can't do it. But it turns out AI can do exactly that. And one of the things that we actually tested is we had 13 cardiologists around the country read 3,000 electrocardiograms, and we said, how well does AI do and how well does a cardiologist do? Cardiologist got 64%, AI got 78%. And this is a yes-no question, so random chance is 50%. So I'm as far away from random chance as I am from the AI model. Now, the thing we realized, though, is this AI model is not meant to replace a clinician. What we've seen time and time again is we come up with new technologies that can do something that a doctor can't, right? When we came up with CT scans, it was better than the physical exam for looking inside of the body for certain things. So this is really, if you take away the word AI, just the next generation of innovation that creates a useful technology that helps us separate signal from noise and figure out who are the patients who are sick that we need to take care of.
So not leaving it up to AI to fly the plane. And you even said that you should use it as a co-pilot. But how do we lean on AI without there being these false alarms or even creating confusion? And even some healthcare workers saying, I might even lose my skills when it comes to leaning on AI too much.
That's a great question. You know, so if I break that into two parts. So one, we have to study new technologies the same way we've been doing for the last 100 years. For any new therapy, any new diagnostic, you have to do the clinical trials. You have to understand how to effectively use the technology and what are the outcomes associated with it. If you don't do that, or you see any fly-by-night operations that aren't doing that, then you should really have a question, right? Because at the end of the day, we know how to study technologies and we know how to create new great technologies in medicine. We've done it for the last 100 years. And so we got to do the same thing with AI that we were doing beforehand. With the de-skilling, the question really becomes, if we get less skillful at a certain thing, does it create increased capacity to get better at something else? And if we get better at something else, are we having a net positive effect on medicine?
There you go.
And that's the real question we should be asking ourselves. Should we reimagine the work of what it means to be a doctor, a nurse, a physician assistant?
I like the way you think,
Dr.
Pierre Elias. Thank you so much. We appreciate it now.